Hello, everyone, and welcome to another Women in Surgery highlight video. I'm Meg Nakata. I'm a fourth-year medical student at UAB, and I just matched into general surgery. And today, I'm just so excited to be speaking to Dr. Paige Porrett. She's an associate professor in the Department of Surgery in the Division of Transplantation. She also serves as the director for clinical and translational research for the Comprehensive Transplant Institute. Dr. Porrett was instrumental in starting the uterus transplant program at UAB, which was the fourth in the United States. And we're so grateful to learn a little bit more about her journey here today. So Dr. Porrett, if you don't mind, if we could just get started by having you share a little bit about yourself.
Great. So it's really a privilege to be here, and I'm eager to share so much with this particular group. Obviously, women are underrepresented, not just in surgery, but in many aspects of academic medicine, and I'll say the powerhouse of life around us. So it's really great to connect with both current and future leaders who are going to propel so much of our important work forward. So I'm a native of Michigan originally, and my route to UAB was rather circuitous, but I'll try to summarize here very briefly. I was an undergraduate at Northwestern University in Chicago, or in Evanston, Illinois, technically, and then stayed in Chicagoland for medical school also at Northwestern. And then I matched into general surgery at the University of Pennsylvania many years ago now, it seems, almost like it was yesterday, but time definitely has passed quickly. And I made the big move out of the Midwest to Philadelphia. And in Philadelphia, I really benefited from a very rich environment that really supported me and grew me in many, many different ways and prepared me for this amazing career that I've been able to share with many of you here at UAB. And in short, in Philadelphia, I did my general surgery residency, and I have an interesting and important story to share, but I essentially took a little extra time out of my academic years, the lab years at Penn, and I actually applied to the graduate school and so completed a PhD in immunology there. That was not part of my original plan, but again, we make opportunities for ourselves even if we don't find them immediately in front of us. And so I essentially really became interested in transplant surgery and transplantation while I was a general surgery resident, although I had lots of different interests at the time. But one of the reasons I took extra time in the lab and really entered a formal degree training, a formal degree program was because I really wanted to have academics be a strong focal point of my career, and thought that what was best for me was really to get formal training in science, which is very different than clinical training. I think there could be great researchers who are also clinicians that don't necessarily have to have these, again, degrees with formal training, but I thought that that was the best choice for me, and can tell you today that I think that was one of the best decisions that I've ever made. So I was out in the lab for a couple of extra years, and then came back to the clinical general surgical residency, finished that up, and then stayed at Penn for 2 years of abdominal organ transplant fellowship, and then ultimately actually joined the faculty there and was on faculty for about 8 years before I was recruited to UAB. And I think an important thing to know about me that might help others who might be struggling either right now or soon to make these types of decisions with respect to their career trajectories is really to recognize that you can plan it as much as you like, and then things are going to take a turn and you do not see, I call it, some really great opportunities that are going to be headed your way in the future, which makes it certainly exciting, but also very, very nerve-wracking. I think a lot of us who are propelled into medicine in general are obviously people who want to help. We're classic overachievers in lots of different ways, and we've really worked hard and done some methodical planning in addition to getting super duper lucky along the way to get as far as we've gotten. So all that to say that our tendency to plan really makes things rewarding, and we benefit from that talent. But it can at times be a little bit of a hindrance, because I think if anyone can really wants to derive, I'll call it some nuggets of gold from this conversation today, is that I wasn't expecting to be here in Birmingham, and I love it, and I wasn't expecting at all to have the privilege of starting two uterus transplant programs in the country and essentially trying to build a field that is brand new. The first live birth in the world happened to a patient who was part of a clinical trial in Sweden approximately 10 years ago. And so in transplantation, uterus transplant is still a really, really new baby field, pun intended. So the long story short on uterus transplant was that I got into uterus transplant really because I had, as you said, Megna, a great mentor, and he was my division chief of transplantation and the Transplant Institute director at Penn when I was there. And he had been at a national meeting at the time, again, this was many years ago now, and had seen this pioneer who brought uterus transplant, who again had this first live birth and uterus transplantation in Sweden, was presenting at a conference. And so in short, that gave him the idea that he wanted to start a uterus transplant program at Penn. And the long story short is he came back and he asked me to do it. And in hindsight, I realized that that was a tremendous compliment because he had confidence in my clinical skills and my surgical skills to be able to learn an operation that essentially very few people in the world had any clue how to do, much less to have done one. But the other reason he really promoted me to do this was because it was going to represent a synthesis of my intellectual interests in the laboratory along with clinical interests. And I'm happy to talk a little bit more about the details of that in a moment. But he gave me some really, really good advice as a leader who was shaping my career, which was, you know, we're so busy and there's so many interesting and important things to do. So how do you pick, right? And how do you synthesize? How do you focus? How do you bring synergy, right, from both your kind of academic or intellectual work along with your clinical work? And I really, really struggled with that for many, many years, actually, as a junior faculty member. And it was really after he convinced me to take on, I call it this wild horse, that I really felt like I had found and not to sound cliche about it, but the niche, right? The place that I was supposed to be and found my passion. And I had no idea it was going to be in this space, but it's really, really fun to be able to, as a female physician scientist, to really serve female patients. And I do think that obviously we cannot, nor should we exclude the contributions that men and our male colleagues make in these spaces. But I do think, and perhaps I'm a little bit showing my biases here, but I do think that there are unique aspects that female providers bring to the care of female patients. And so it's just a really powerful place to be.
Definitely. Thank you so much for sharing. And that's a really great perspective that you brought about you can only plan so much in your life and your career, and really being able to make the most of what life brings to you, I think is great to hear. What you said towards the end brings me to my next question. Do you feel like you've faced any challenges as a woman in a surgical field? And if so, how have you overcome them?
So a lot more to say there than can be captured in a few minutes, but I think the short answer is yes, for sure. You know, despite being surrounded, I think, throughout my career by really supportive mentors that were both men and women, the vast majority of them have been men. And I think that there's a lot of difficulty that it's not, again, intentionally brought to female trainees and junior female professionals, but the entire landscape, the world around us is really built for men. And the older I get, and perhaps the more jaded I get, the more I realize how important this is. And without waxing too philosophic about it, I remember reading several women in leadership types of book series or different novels, like or autobiographies. So I'm thinking specifically about Hillary Clinton's book entitled "What Happened," which some of this group might have read. And I think it was in Hillary's book, or it was in another one of these resources that I mentioned, that someone was pointing out how important it is for female leaders to be at the very, very top to help essentially promote women, the ability of women professionals to really make really long lasting and sustainable contributions to change around us. And so I think that where I'm trying to go with this, to answer your question, Megna, is really about the barriers that I have perceived, I think, are more systematic and cultural that continue to persist, I think, because we still lack female leaders who can, in really high level positions of power that can help provide that balance. Because again, I think that it takes people who are actually experiencing the problems, the microaggressions, et cetera, that are out there, the constraints on our time, that in order to really make the sustainable change that's going to help people do it. And again, with due respect, I think a lot of that is just, it's unrecognized, right? So I think, for example, and I'm forgetting the exact circumstances, but it was fairly recently where I had a male colleague who's extremely valuable to me. He's a really great individual, but he was talking, and the context doesn't really matter, but he brought up the point that he was a bit frustrated that there were groups of female colleagues around him who were essentially still drumming the proverbial drum. I'm putting words in his mouth, but about how he just didn't realize that it was still necessary to have, we'll call it things like, we'll call it affirmative action protocols and things like this. And I remember actually disagreeing with him. And again, this is pretty recent, where I said to him, I'm like, well, we still need those things, right? So the day that I perceive we don't need those things is when women are actually represented, of course, way through and have clearly broken through the glass ceiling and no longer get pushed off of the glass cliffs that we also hear about. And when I look around me, I think there's tremendous diversity here at UAB that is deeper, frankly, than I saw at some of the prior institutions that I've been at in terms of women in leadership positions. But they're still not there in every single space. And especially within surgery, as you look within our national community, and we're not talking about practicing surgeons, clinical surgeons only, we're talking about women who are, for example, in the American Board of Surgery, right? Who are not just on the board, but are actually the leaders of said board, the leaders of said professional organizations, the leaders of our regulatory agencies, of the agencies that dictate how education is provided to, for example, surgical trainees. I mean, there's a lot of different roots to that tree. And I think that we are still absolutely lacking women in those positions of power, where they are actually the deciders who can shape the change that we need. And again, I think both directly and indirectly, patients really need this, right? They need to have access to women providers for lots of great reasons. And I think that until we actually can truly promote all of us as trainees and junior faculty, et cetera, even senior faculty, into that next level of power and position and influence, that we're not going to really achieve those goals. So we could argue all day whether affirmative action programs actually help us do that. But I think that at least in concept, even if in application, if they fail us in concept, they're still very, very much needed, because we do not have the parity across the board. And obviously there's a lot more to unpack here that doesn't affect just women professionals, but also, colleagues in, I'll call it, other disadvantaged groups, whether it's by race or by, sexual orientation and all of these types of things. So I think that there's great strides that we still have to go. So I'm not giving you a set of concrete specific barriers to me personally, but I think that this is just, I've seen lots of places in my life where I call it, there's a void, right? Or something that's, I feel like, holding me back because a female leader has not been there, or I call it a pioneer in front of me to really fix that problem as well.
Right. I think that's a really great point, because I think a lot of the times we focus on representation in the field, but really going the next step and having representation in leadership as well is huge.
Yeah, I would argue, actually, and this may not be a popular sentiment, so feel free to push back on this, Megna, but we can fill the ranks. We could be every single provider that's out there, but until we are in charge, it does not matter whatsoever.
Right. Thinking about that, as well as mentorship that you've had during your career, do you have any advice for women medical students who are pretty early on in their training and might be interested in exploring surgical specialties?
Yeah, I wish I had really great advice. I'll do my best because it's a really important topic, which is the topic of mentorship. And I think that probably the best, most succinct advice I can give is not necessarily anything new. It's to find the best mentors that you can find in all of the spaces that you can find them. And again, it would be great if you could find those mentors that are women, because I do think that like female mentorship is really, really important for a couple of specific reasons, which I can elaborate on. But I think that big picture, the most important thing is to find the people that are going to be in your corner. And what do I mean by that? I think it's really important to have an open mind about who your mentorship team is going to be. And there's two things I want to emphasize there. One is that it is a team. You are not going to find, and maybe none of you are like me, but I definitely had this misconception. I thought I would find one or maybe two like core mentors that were going to be able to teach me everything that I knew. And that is so not the case, right? So mentors come and go. Your relationships change with them over years, right? As one advances or even changes track in a career, you need to add mentors to that team. And they need to come in all shapes, colors, and sizes. The better, in my opinion, the better you will do, the best you will do is with mentors who actually are really, they're kind of like your parents, for lack of a better word. They're people who really want to look after you and have your best interests in mind, but they're not going to hesitate to actually give you a piece of their minds about something you need to do in your future or an opportunity you should be taking that frankly you may not be super excited about. So I'll come back as a concrete example to Dr. Avi Shaked, who was the mentor who helped essentially push me into uterus transplantation. When Dr. Shaked came back from the conference that I mentioned, and he said, Paige, I want to start a uterus transplant program at Penn. I think you're the person to do this, in concert with, of course, great colleagues in the Department of Obstetrics and Gynecology. And I looked at him like he had like four heads. I was like, absolutely not. I thought it was too fringe. I didn't know anything about the patient population. I was an assistant professor just trying to make it and to survive. And I thought it would just be too risky, for lack of a better word. And I was very afraid of it. And long story short is Dr. Shaked was a great mentor in the sense that he did a couple of things. First of all, he gently continued to push and propel me and nudge me. We came back to this conversation literally several times over a period of months before I finally assented and agreed to do it. So my point is that he gave me the space that I needed as a mentee to get there on my own, because I didn't see how right he was about a great many things, right? But he did provide that guidance, and frankly, in a good way, he was like a bit of a pit bull or a rabid dog. Like he wouldn't let it go, right? He wasn't going to let me say no. He didn't take no for an answer. He just postponed a yes, right?
Right.
To keep coming back at this. And I learned a lot from him in many domains, but especially in that moment of now as a mentor myself, right? How do we help our mentees come forward? And I really thought of Dr. Shaked very much as a father figure, because similar to my own personal experiences, my own dad, like he did the same thing, which is he gave me the advice that I didn't want to hear, right? That I wasn't ready for or whatever, and then waited for me to kind of get there, right? But didn't give up on that. And I think that that's something that as a mentee, one really needs to be, you will find the best mentors by being the best mentee and being open to their actual suggestions and advice, right? But can be a really complex relationship, and frankly a difficult one at times. Again, similar with our own families, right? That the people who are very, very close to us and are best suited to give us the guidance that we look for, sometimes that guidance is not always welcome. So recognize that in yourself as a mentee, that when you're seeking those great mentors, that they may come again in all those different shapes and sizes, but it's really important to actually be open to the advice that they give you, even if at the time you think that it's terrible advice. And I'm not suggesting that anyone takes terrible advice, but I'm saying it takes a lot more than your initial kind of that gut judgment that comes in to say, hey, maybe I should give this more thought, or why is this person suggesting this to me, right? To use, I call it more of what's up here rather than down in your chest or your gut. Now I've gotten so distracted from I don't know if I answered your question, Megna, but that I think is a really solid piece of advice, because our mentors, I remember one other thing I wanted to add on it is not just about mentors in a career. Someone a long time ago introduced me to the idea of a sponsor, which is something I think that is language that comes out of the business world much more than we see it in academic medicine. But it's important to develop sponsors as well. So these are people that you don't necessarily directly work with, that you don't interface with very much. I call it, it's not like a parent, like a mentor. And a diverse team of mentors. It changes over time, but sponsors are very influential people in different spaces in your career, right? That can help you, I call it, much more indirectly, but still incredibly powerfully from behind the scenes. So these are people who might give you an opportunity to be, for example, invited for a talk, to participate on some big project, but not somebody that you directly work with, so that they have a much more, I'll call it, kind of big picture and objective look at this. Whereas your mentors, in my opinion, should be people who are not just really invested in you professionally, but are invested in you personally too. And again, these people, my bias, perhaps my stupidity would be the right word, my ignorance, was that mentors would just kind of be around and I wouldn't have to do much work to find them. But I think that the reality is the best mentors are ones that, if you happen to have the great fortune to come upon one just serendipitously, that's great. But I think the other takeaway here is that you really need to have a very active, almost aggressive approach to finding them. So if the more insight you have into yourself in terms of what your strengths and weaknesses are, where you need help, right, to bolster an area of weakness that you're in, that'll give, the more insight you have into yourself in that way and what your professional needs are, the better suited you are to go after and find those mentors you're looking for. And all the more reason to do things that, again, for an introvert like me, are difficult, which is to go to meetings, right? If you've read so-and-so's paper that you find influential, you saw somebody on YouTube, you saw whoever in the newspaper, go ahead and reach out, right? The worst thing that happens is that person doesn't return your email, and then you email them again, and you email them again, right? And you find them at the meeting that you go to next week. And now I sound like I'm turning everybody into stalkers on this YouTube video, but the reality is that it will pay off, and the person that you're trying to gain, I'll call it 5 minutes even of time with, I mean, your time investment in that can be very, very well received, right? Because all of a sudden that person will look at you and say, hey, I know you're the person I've gotten 5 emails from, and wow, like this is what we want to do together, kind of thing. So just don't be passive about it, I think, is my takeaway.
Right. I think that's so helpful to hear, especially at my phase, where we're still very early on, but it might be intimidating to make that next step at a national meeting and go up to someone. But I think doing those things is so important.
Yeah, I think you nailed the word, Megna. I wish that I could, both for myself personally, as well as for all of you and many other, especially again, women professionals, that I wish we could just somehow eliminate the word intimidating from our vocabulary. So I do think, and again, many may disagree with me on this, but I think that women, especially young women, tend to be more off-put by this word intimidating. And when you realize at the end of the day, what do you have to lose, right? It's just one more person who shuts the door in your face. Well,
yes,
that's nothing new.
You were right when you said the worst thing someone can do is not reply or say no, which really at the end of the day aren't scary things at all. So
yeah. And if I can share one more anecdote along those lines, which is not exactly related directly to mentorship, but I think is still a great a great lesson that I've learned over the years. Again, I think so applicable for everyone, but particularly um, powerful for, again, young women coming up in a profession, especially one dominated by men,
Mhm.
that um, you will be surprised by what you get if you ask for it. And a very concrete example of this for me was when I made a decision to take a little, or I wanted to take a little bit more time off in my lab years, right, to formally pursue a PhD in immunology. And again, this was a crazy space I arrived to because I had never expected to want to do this.
Mhm.
I had no idea how to do it. I just knew that as I started to investigate that as a possibility, there at the time at Penn, there had not been a path like this crafted yet. So I was going to be, whether I liked it or not, a pioneer to set this up, right? And all I wanted to do was just take a few more years out of residency and join the graduate school and take classes and work in a lab for a few years. But of course, somebody's got to pay for that. Someone's got to pay for my salary along the way. So there were a lot of really important kind of logistical considerations around this. And so I remember having this conversation with my husband, who's a basic scientist, and I was like, I really want to do this, but I'm so scared. Like, I'm gonna, what am I supposed to do? Walk into the chair of surgery's office and be like, hey, this, start with the program director. And I'm laughing about it because even to this day, it still scares me, right? And then I went ahead and did, I was kind of like, oh, what the heck, why not? What's the worst that will happen? Like, I don't think they're going to fire me from the residency program, right? The worst thing they'll do is say no. And I'm right back where I started. So there's no loss on this. And so, except for some of my time and some of their time, right? And so I remember going into first the program director's office and saying, hey, I would like to take more time out of the residency to pursue this. And I like cringing already, like waiting for the no, like here it comes. And he goes, well, of course, like, because he could tell that I was nervous really and really uptight about it. And he was like, well, of course you can, right? It was almost like he'd been waiting for it, honestly. So then I went, okay, well then now what do I need to do, right? He's like, you need to go to the chair and I need to find out all these other details. And anyway, so I went to the chair and said about, I'm going to take some extra time out. I've got Dr. Morris's support and this kind of thing, and we're working on a plan. And he was like, and essentially what I was asking him to do was to support it, right, financially with dollars. And he said, of course, right? And he happened to be, and still is to this day, one of the most intimidating people that I've ever met. A man by the name of Dr. Larry Kaiser, who's a thoracic surgeon who's been the dean of various institutions over the years. But anyway, all that to say that I've replicated this now several times, not exactly this particular circumstance, but make your ask, right? And make it frequently. Be intelligent when you do this, like really make sure that you can understand why the other body, the other entity might say no, or what the barriers are in front of that individual or that group of people that might stop you. But the point is, like, at no point whatsoever should any one of you all should be satisfied with your current lot. And if you need a path forward that looks like X, just because somebody else didn't pioneer it for you, doesn't mean de novo, by default, that you're not going to get it, right? Do not be afraid to ask.
Yes, I love that. Thank you so much for sharing those
Of
anecdotes.
course, yeah.
Our next and final question is a little bit more about your personal life. So could you tell us about maybe one of your hobbies or something that you enjoy doing outside of work or the hospital?
Mm. Well, I came to being a parent as I call it a later aged mom, which also might be of relevance to people in this group, especially those pursuing, I call it a lot more years of professional training in front of you. But I have a 9-year-old daughter, and so she is the gem of my existence and really the person that she's now my hobby, I guess you would say. I'm very into her. But I say that jokingly, but it really is all true, which is I really enjoy being a mom. I wish I could be, frankly, a much more traditional mom in a lot of ways. I wish I had more hours in my day and night to be with her. But one of the things that I really kind of enjoyed as a new hobby alongside her, ever the eternal student, but I would I think this is a great pearl to leave all of you guys with here. Or I should say you gals. I'm not sure what the word is. We don't have a great set of gender neutral pronouns in the English language. Conversation for another time. But if any of you really want a couple great reads, I highly recommend the Bedtime Stories for Rebel Girls series. So you all should be Googling this right now.
Yes,
And
I'm taking notes.
yes, there's multiple books in this series. New York Times bestseller, of course, from several years ago. But the reason I bring it up in the context of my daughter is because I really like to spend a couple of, some time, several times during the week where we will actually read individual bedtime stories for the Rebel Girls. And these books are incredible, not just because my daughter and I love them, but because, as you will love them, they are the untold stories, right, of every single Rebel Girl from here back through the ages. And again, there will be names in that book that you will recognize, contemporary figures, historical figures that you know of, but perhaps more powerful across the different disciplines that are featured is how these women and young women and girls have made impact over time in places that you have never heard of. So it's the untold stories, the stories that you and I never heard of just incredible strength and intelligence and bravery, etc., that never made it to my classroom or the movie theater next to you, etc., but are like real people who've done this literally over thousands of years. And it just puts everything really into context, and I think is just incredibly powerful and inspirational. So now you guys have even more things to do with your precious time, but hopefully well worth it.
Yeah, so now I have plenty of time just finishing up medical school and now in these last couple months that are nice and free. So I will definitely be looking into that.
Yeah,
But thank you so much, Dr. Porrett, for spending time with us today
my
and
pleasure.
sharing your advice and your wisdom with us. I know everyone appreciates it.
All right, be well, everyone, and congratulations, Megna, and to all the people that whose faces and names I don't know on matching, and for those of you who are still, I call it grinding away, day in, day out, taking those classes, worrying about the future. It's all going to be okay. That's what my mom said, and bless her soul, I think she's right.
Yes, definitely. Well, thank you so much.
Okay, I'll talk later.